Okay, welcome everybody. It's nice to see so many familiar faces and so many new faces too. I'm Kathy Rowe, Executive Director of New Jersey Advocates for Aging Well, and today I'm bringing in our partners from the Goals of Care Coalition, Sandra Clark and Lori Feldstein. And I feel like we go back a long ways now, Lori. One of the things that we feel is really important to aging well is advanced care planning and especially the options for palliative care. And we were very proud to have supported the legislation that established the Medicaid benefit in New Jersey for palliative care. And right now, Lori and her team are undergoing an outreach program. They've probably been in touch with several of you, um, and we'll follow up with you afterwards to bring a special ambassador program to communities to explain this benefit to people so they understand it better, they learn how to use it in advance of needing it, basically, in advance of a medical emergency. So we're really happy that they could join us today. I'm going to let them do all the talking and turn it over. But again, if you have questions, we want this to be interactive. So you can put it in the chat, you can raise your hand. And if you don't mind, because I'm glad I don't recognize all the names on here, put your name and your organization in the chat as well. So we have a better sense of who's represented here today. So with that, I'm turning it over to Lori and let's go.
Great. Well, as I said, nice to see everybody. Some familiar faces, some new faces. So I'm really terrific to I'm really glad to have an opportunity to talk with everybody today. I'm going to take just a minute to bring up my slides. But before I do that, we're really grateful for this opportunity to share with you a little bit about the Goals of Care Coalition of New Jersey, and more importantly, information about a new program that we've received grant funding to bring to patients and caregivers across the state to educate people about the new Medicaid community-based palliative care benefit. And as we started our outreach to senior centers, to low-income housing buildings, to bring to our outreach to the community-based organizations, we began to realize that a lot of people we were talking to, just like many of the clinicians across the state and patients and caregivers, don't really know what palliative care is. And therefore, it was hard for people to commit to doing a program for their community on palliative care if they didn't understand it themselves. So Kathy suggested, and we happily agreed to provide this talk today, where we have a brief chance to share with you a little bit about what palliative care is and who it can help, what the Medicaid benefit looks like, and then talk with you at the end about specifically our equity and serious illness program and our ambassadors, some of whom are even on the phone here today, who can come into your communities and who can deliver this talk to help connect people in need with resources that are available in the community as part of this Medicaid, this new Medicaid community-based palliative care benefit. So like Kathy said, I'm going to jump in, but please feel free to ask questions along the way or pop your questions into the chat and somebody from our team will reply. So hang on and I will share my slides. Okay, hopefully you can now all see my slides. So this is the presentation that our ambassadors will come into the community to deliver. So it is our Living Well with Serious Illness talk, again made possible by a very generous grant from the Henry and Marilyn Taub Foundation. I'd start by sharing a little bit with you about myself. Kathy already introduced me as the CEO of the Goals of Care Coalition of New Jersey, but really today I am here as the daughter of my dad. You see in the center of the slide and to the right pictures of my dad with my family. And I am talking with you today from the perspective of a caregiver. I these pictures you see here on the slide are pictures taken from an adventure we had in Costa Rica. My dad was 79 years old, and this picture was taken just 1 month before he was diagnosed with cancer. My father lived for 11 months, but during those 11 months, he spent nearly 200 days in the hospital. He endured it, he underwent surgery, he had lots of different complications. He had infections, he was in the ICU, he had multiple different procedures. And as his daughter and as his primary caregiver, I saw him suffer a lot during those 11 months. I also suffered a lot during those 11 months as his caregiver. And looking back, what really, what really I reflected on was not what happened to him medically, but I really began to understand all that didn't happen in his serious illness journey. Nobody ever sat us down and had a conversation with us about what really mattered most to my dad during this time. No one talked to us about goals of care or what my father's wishes would be. Nobody asked how he wanted to spend the time that he had left. And certainly nobody introduced us to palliative care. I had no idea that there was a specialty that was focused on relieving suffering for patients. And I kind of came out the other end of this experience thinking like, if only someone had talked to us about some of these important things, the last year of my father's life would have been spent very, very differently. And so, you know, I can't say that palliative care would have changed the outcome for my dad. Cancer is cancer, and my father's prognosis was not good. But I know that if we had had access and an understanding about what palliative care was and how it might help our family as we went through this serious illness journey, I am sure that it would have changed our experience. It certainly would have changed the way that my father spent that last year of his life. And I often think to myself, he planned for his death. He did his will. He made sure we knew where all of his important papers were. But no one helped him plan for the way that he might spend the last year of his life or how he would live in that final year. And that's really what I wanted to share with you all today. Um, there is today a reason for us to have this conversation. As of April, New Jersey Family Care, our state Medicaid, began offering a brand new benefit for community-based palliative care. And so today I want to share with you a little bit about what palliative care is, who it's for, and how it can help the communities that you're serving. So we're going to start by just talking a little bit about what palliative care is. And the reason this is so important is because most people don't actually know palliative care exists. They don't understand and they haven't heard about the kind of support that palliative care provides, or worse, they think it's end of life care. If they've heard anything about it, they may be confused about it. And that is true not just for patients, even some healthcare providers don't really appreciate what palliative care is. And when there's a lack of awareness, when people don't understand it, for sure there will be limited access. So the point of us talking today is to make sure you all understand what palliative care is and how it can help. So I'm going to start by sharing a definition about what palliative care is. It is specialized medical care, but its entire focus is on improving quality of life by easing symptoms, by helping patients and their caregivers deal not only with the symptoms that are a result of the disease itself, but also of the associated side effects for treatments. It is also intended to help reduce stress and the distress of dealing with a serious illness so that people can live a lot more with a lot less burden and have many, many more good days at home. After all, that's what most patients with serious illness want. They really want to be at home, surrounded by their community and their loved ones. And palliative care, when it's delivered in the home and in the community, make it easier for people who are living with serious illness to remain independent and stay at home longer. It's also important to understand that the palliative care team is a team that works with your existing doctor. So if you're a cancer patient and you have your oncologist and the team of people in the oncology office, the palliative care team works alongside them. They provide an extra layer of support. What does that really mean? It means that this team of people, this collective of people, of providers you see on the right side of the screen, work with your doctor. They work with your oncologist if you're a cancer patient to manage the symptoms and stress of your cancer or your serious illness. And they deliver care that's specifically based on your needs. So your care team might include a palliative care physician, but it also may include a nurse, a social worker, a spiritual care provider, or other members of the team, a nutritionist, for example, as well as access to care 24/7. So, this is very typical of what a palliative care team looks like. And this is the extra layer of support that patients would get on top of their regular doctor. It's also really important to understand that palliative care is care that can be given at any age and at any stage, at any time during a serious illness. This is not meant to be only an end of life care type of support. In fact, we would like to see more people being able to access palliative care even upon diagnosis when there's an expected um, result of treatment being a burden on the patient and their family. The other important thing to talk about with regard to palliative care is that its focus is not only just the patient, it's also intended to support the caregiver. And that's really, really important. The oncologist or the doctor that you're dealing with for your illness is really focused specifically on you as the patient. But the palliative care team is also there to support the caregivers and to help patients and caregivers navigate the choices that they have with regard to their care so that it reflects the goals of the patient and their family unit or their caregivers. Really important for us to stress that palliative care is not hospice. This is exactly the misconception that we're trying to address in all of these programs. Palliative care, we say palliative care is for people living, and the emphasis is on the word living with serious illness. You'll see that both hospice and palliative care share a lot of core fundamental principles. Both are providing physical and emotional support. Both are focused on quality of life and delivered by a team of people, and both types of care are available in the home. But hospice care, which is exclusively focused on comfort at the end of life, is meant to support patients who are dying, those who have 6 months or less to live. And the goal of focus is to help patients to die well. That's very different from palliative care, which is provided alongside regular treatment and gives this whole additional layer of support and team to help patients live well with serious illness. So it's really these two types of care, palliative care and hospice care, serve two very different populations. Hospice care, again, meant for those who are dying with less than 6 months to live, whereas palliative care is meant for people who are living, often for many years, with Alzheimer's or cancer or other serious illnesses. And palliative care is meant to support them living well through their serious illness journey. Are there any questions so far, or Kathy, anything in the chat?
No, I don't see anything yet in the chat, but does anybody want to chime in? So I do, I'm glad you pointed out that the difference between hospice and palliative care, because I think that's where a lot of people get lost. They just assume it's the same, but there's no time limit on serious illness or palliative care, right?
Correct.
Yeah. And even
Correct.
though hospice, you might, live beyond 6 months, but there's no estimated timeline when we're talking about palliative care.
Exactly. And in fact, we're trying to encourage earlier access to palliative care so that patients' experience with serious illness can be very different from my father's experience with serious illness, right? If my father at the beginning of those 11 months had received palliative care, he would have been at home. He would have been able to take walks outside in nature, which he loved. He would have been able to watch his beloved New York Giants, even if they were losing. He would have been able to do the things in that last year
Yeah.
that would have brought him joy and happiness. I would have felt better supported as his caregiver. And so, while my father did access hospice care, it wasn't until literally 48 hours before he passed. That was
Mhm.
too late to make any real difference
Right. Right.
to him or even to me in that final phase of his life. If we had had access to palliative care, we would have been better supported for those 11 months that he
Mhm.
was experiencing his serious illness before he died.
Yeah. And that's also just want to point out that very often in New Jersey, especially that people are accessing hospice way too late, like in days, hours even, and we're not using it for weeks or months to be at home or in the setting that they want to be in. So, yeah, hospice is not utilized as well as it should be for patient care either.
Exactly. And I think a part of it is that people don't really know what to expect from palliative care. What is it like to get palliative care? So we have a short video, which I will play so that you can understand a little bit more about it. 73 years old. I've been married 51 years to my very beautiful, helpful wife, and her name is Gladys. We have 5 beautiful children and 9 beautiful angels, which are my grandchildren, and I love them very much. My life was a disaster. All I could do was stay in the bed.
Is the video progressing for people?
Mr. Easterling is the kind of person who
It's a little choppy.
Is the video not working?
I can hear the audio really well, but at least on my screen, it's not moving. It
Yeah.
just looks like a screen.
Yeah, the video is advancing.
Okay, I'm going to stop the video. I'm not sure why it's not working, but hang on just one second. Let me stop the share for a second and see if I can bring up the video.
Maybe we can just hear the video and not hear it and not watch it.
Yeah, we could do that. I think I can explain the video.
Okay.
It's essentially the video explains that he experiences the kind of support that allows him to go to church, which he loves to do with his wife, to go shopping with his grandchildren, which he loves to do. He gives a line at the end that says, palliative care isn't treatment. It's like going for a treat. That's the final sentence that he says. And it's meant to, and there are some people on the call here with us today. I don't know if you see me or others want to come off mute to share some specific experiences from their own work about what it's like to receive palliative care. But in this video, we absolutely hear him talk about how difficult his life was before accessing palliative care and how palliative care allowed him to get back to doing the things in his day-to-day life that he enjoyed doing most, like going to church and going shopping with his grandchildren and that sort of thing. You see me, I see you came on camera. You, as a palliative care nurse, maybe can share a story or two about what it's like for, your patients.
Hi, yes. Hi, thank you. One of the things that for family members is comforting is knowing that they have someone to call. When you're home and you have questions or you're concerned that someone may not be feeling well, they're having a bad day, knowing that you have someone that knows them as a family to call is always very comforting. So that when I have family members call me, this is happening, what can I do? Do we have the resource to have a nurse come to the house and check in? Or is it something that I can do over the phone? And they feel very supported. And sometimes I reach out to parts of their medical team, right? So if it's an oncology or a cardiologist, I can talk to them as well. And so they also feel that communication amongst the team is really helpful.
Thank you so much for that. Yeah, I
Mm-hmm.
think it's that knowing, it's that relieves a lot of stress and distress, right? Knowing there's someone that you can call. So I think those are the kinds of things we hear from patients all the time. I'm going to go ahead and move to my next slide. So hopefully you guys can see this. So there are a number of questions that can help you determine whether palliative care might be right for you or for a loved one that you might be caring for. So first of all, do you have a serious illness? Any one of these types of illnesses are those that might make one eligible to participate in palliative care. Also, do you experience any significant impact from dealing with that serious illness, side effects from treatment, problems with eating due to serious illness? Have you been in the emergency room or been admitted to the hospital in the last 12 months? And then really trying to understand the symptoms that make it difficult to be as active as you'd like. These are the types of things that would be obviously impacting your quality of life. If you were experiencing pain and discomfort, shortness of breath, fatigue, anxiety, depression, any one of these may qualify you for palliative care support. And then whether you're having issues knowing what to expect or making medical decisions about treatment choices or understanding the pros and cons, the benefits and burdens of different treatment. If you require emotional support or spiritual support, these are all reasons to access palliative care and would make you eligible to participate. Palliative care is today covered by, or some services, I should say, for some palliative care services are covered by traditional Medicare and by Medicare Advantage. Certainly, if you receive palliative care consult in the hospital, that is fully covered. Physician and some nurse visits are also covered by Medicare. But today, our focus is on what Medicaid is covering for Medicaid recipients and dual eligibles for the MLTSS population. So as of April in New Jersey, and we are only the third state in the country to actually cover community-based palliative care for our Medicaid population. Today we can access the full set of services that is being provided by Medicaid. And I want to just walk you through at a high level what those services are. All Medicaid recipients, New Jersey family care members with serious illness, are eligible to participate if they have a serious illness. And I'm going to talk a little bit about what serious illness, how serious illness is defined by the state. But this program, again, does not require a terminal prognosis. It does not require that you give up curative care or your regular treatment. So again, if you're a cancer patient, this is added on. These are services that would be added on top of your regular treatment. And the types of services that are covered are in that purple box off to the right. So it's help in care planning, making decisions about what might be right for you. It's facilitating those goals of care conversations and coordinating care between different doctors who could support you or different clinicians who could support you and address the stress and distress of the serious illness. It's help with pain and symptom management, of course. It's also advanced care planning, spiritual support, caregiver support, and that all important 24/7 access to care. So who's eligible? Medicaid members and dual eligibles can qualify if they have a serious illness. Some of the examples are in that purple box off to the right. But in addition to having a serious illness, they also have to have either some difficulty with one or more activities of daily living, or they have to have visited the emergency department within the last 6 months, or have been hospitalized in the past year. So someone with cancer who's been in the emergency department as a result of their disease in the last 6 months would be eligible to participate in this benefit. And it's really easy for people to self-identify as somebody who should have access to this benefit. The state has created this very simple 3-question screener, and we'll be handing these out at all of our events to just make sure that you've met the criteria. Number 1, you do have a serious illness. Section 2, that serious illness is impacting your quality of life. And Section 3 is meant to help identify what the greatest need of the patient or their caregiver is. That triggers the beginning of the process to accessing this benefit. So once that eligibility screener is completed, it can be shared with your doctor or with your managed care plan, and you would then make an appointment with your physician to complete a comprehensive medical assessment. That would then get submitted to the managed care organization, and once you were approved, you would begin to access the community-based palliative care program.
Lori, just
Yeah.
how long should people expect to take for the approval? Are we talking weeks, months? Do you have
No,
any
very
date on
quick.
that yet? Okay.
Yeah, so it's not this is not days, this is not weeks to months, this is
Okay.
days.
Okay.
A care manager would be put on the review, and that would happen very quickly. So as part of this program, we have a lot of tools and resources. We hand these tools and resources out at all of our events. They are available in multiple languages, and you can, for those of you who may want to share them with others, they are all on our website and downloadable for free. Information about palliative care is available in our About Palliative Care brochure. And on our website, you can access a directory of all of the palliative care providers in the state. You are able to identify those palliative care providers by zip code or by the community that you live or by insurance. If you are a Medicaid recipient, you can filter to identify all of the providers in the state who are participating in the benefit. We also have brochures available in multiple languages on palliative care, what you should know, and have a number of different resources available to help guide you through medical decision making and to help you prepare for conversations with your doctor about medical decision making and specifically about access to palliative care. That is the bulk of the presentation. I'm going to stop there, see if there are any other questions, and then we can turn it over to Sandra, who can share with you guys a little bit more specifically about our ambassadors initiative and how you might be able to have an ambassador come to your community and speak with the people that you serve. So why don't we pause for a moment and see if there's any other questions?
Lori,
And
I do
any,
have a question. I'm
go ahead.
sorry.
Hi,
I,
Adrian.
I drove an hour to a meeting and I wasn't supposed to be there. So this worked out well because I can listen on my way home, which is great because I always hear something different. And so I have two questions. You mentioned that MLTSS program, and as you know, I'm more like the emotional, mental, spiritual person who also brings in resources. But when I think of that program, I think in terms of going through like the county um, aging departments and filling out that application. I guess I guess my question would be, how is that different or the same as Medicaid? Because I always looked at it as two different. I think my understanding is that if you were eligible for that, you're probably eligible for Medicaid, but are they two separate programs, for lack of a better word? And my second question is, before I mute myself again, is how much flexibility are the providers going to be given? Um, and when I say that, I mean, like, I know like in hospice, they can determine, okay, we're going to push that. We're going to push, the nurse visits to twice a week, and then it's 3 times, and then it may be every day. So how much, for lack of a better word, are there guidelines that they have to follow? Do they have to, I know I learned last meeting about the, like the spiritual support. I didn't realize that was a part of it. Now I realize that's a part of it.
Oh,
But
yeah.
so are there guidelines to, or is everyone going to operate differently? Or like, I guess that's my question.
Okay, let me take the second question first, and then Kathy, you can take the first question. So, um, Adrian, it is a great question about the flexibility of what patients can expect to receive in terms of care under the palliative care benefit. And while the state has set a floor, meaning there's a minimum amount of times that the providers and patients need to see each other every month, there is no maximum. And the amount of times and the people who will visit with those patients throughout any given month are determined specifically by the care plan that the patient and the care team work on together. And those needs can change month to month. As you know, the journey, the serious illness journey can be a long time, years long. And over the course of those years, patient needs will fluctuate. Sometimes on a monthly basis, they may need several visits from a physician, from a nurse, from the spiritual care provider, from a social worker. And that may require, as you said, daily or weekly visits. There are other times in the trajectory of a serious illness where the patient is doing better and where those needs may be less. So the state requires at least one meeting between the palliative care team and the patient every single month that the patient is enrolled. But if it's a month where that patient and their care team have agreed that the needs are significantly more, that patient might be seen several times a week by any one of the members of that care team. So I hope that's clear. It's very much driven by the needs of the patient.
Yeah. And for the benefit and eligibility, so palliative care providers, they are certified as palliative care providers. And then, and then we get into insurance in the US, which makes everything complicated. So, you could go now to a palliative care provider if your private insurance covers it, if they take your insurance, all of that. What this benefit does is all people on Medicaid now have this as a benefit because Medicaid is really just an insurance policy, right? And it determines what's covered and what's not, just like your private insurance or Medicare. So if you have Medicaid, Medicaid will pay for this and it's included. There are people who, because of their illness, and it alters their either their their ability or their finances, there are people who either are or will qualify for Medicaid. And if they enroll in Medicaid, then they can get this. And I think that the easiest way for older adults to enroll and to have it done quickly is going to their county office on aging. It can be done directly. There are other ways people can go online, but the easiest way for most people is to go to their county office on aging for the advice on how to get Medicaid and find out if they qualify.
So I
So
guess my question,
everybody,
I'm sorry. I
did
guess my
that
question
answer
is,
it?
no. So is that MLTSS program that is offered through the county agent, is that the same as Medicaid, or is it how do those two programs because when I look at that MLTSS program, I can see that you can get these things, but I don't see palliative care as that. So once Lori's
Sure.
mentioned that, I'm wondering how does Medicaid and that program, how do they coexist or not?
Medicaid,
Yeah. So
MLTSS is one of it's like a subcategory of New Jersey Medicaid. It's New Jersey specific. It's not offered the same in every state, but
right.
so this is it's a subsection. It's more specialized because that's based on your needs. And where Medicaid is your income.
Long-term services and supports, that LTSS, are made available to people that have serious illness. And part of those long-term services and supports might include home delivered meals, a home health aid. And what the community-based palliative care benefit does is it bridges a gap for this population who have qualified for Medicare, yet we know Medicare doesn't authorize or cover often this community-based palliative care. You can receive it in hospital clinical settings. So MLTSS might be administered in a different department of Medicaid than it is, but it's to the same population. It's just for that population who qualify both for Medicaid and Medicare, but they're distinct services that bridge a gap. Palliative care is delivering that clinical team that's specialized and trained, that a home health aide that's supporting activities of daily living simply doesn't have the skills to deliver.
And just to be clear, accessing the Medicaid benefit for community-based palliative care does not in any way jeopardize access to all those other
Right.
services that they may be eligible for as well. So Sandra, I think at this point I'll turn it over to you, and we can share a little bit more about the ambassador program.
Awesome. Well, I'm so excited to meet all of you and share more about the ambassador program. My role at the Goals of Care Coalition is to support managing and ensuring that this program is a success. And I'm going to share with you some insights about who our ambassadors are. So Flory, if we can go to the next slide. And how they do what they do. Like Lori was saying, part of why we developed this program is that not only does the message matter, all that information Lori shared, how it's shared, and who is delivering it. All of those are very important when it comes to sharing information about the topic of palliative care. And so we have done outreach and have recruited 2 cohorts of ambassadors representing nurses, social workers, community health workers. We have a chaplain. We have other faith-based leaders at community-based organizations, folks representing culturally specific communities. And I just want to call out, Adrian is one of our ambassadors, so is YouSeeMe. And what our ambassadors are doing are conducting these events, just like what Lori delivered earlier, these events in person in their communities, using this presentation so that what they're delivering is information that's consistent. And ultimately, this is one of the ways that we're fulfilling our mission to help older adults and people with serious illness, as well as their caregivers, actually access this benefit. Because as we know, it's really different to have a set of services available and for people to be willing to say, yes, I want to be screened and to actually access that. Lori, can we go to the next slide?
I did.
Oh, you did? Okay, here we are. So like I was saying, so in terms of what they're sharing is culturally responsive information that's accurate. The key differences between palliative care and hospice, and really opening that question to emphasize how palliative care is not tied to prognosis. And then sharing information about this new benefit that's simple, easy to understand and access, because that can be another barrier is some of the information that's published by Medicaid offices can be complex and difficult to understand. So we make it simple. And then we're also encouraging that they talk to their loved ones and have conversations about care preferences. Ambassadors are equipped with all of these print materials that support those future conversations and connecting people in need with information and resources, and also being a connector in the community to other services providers as a result of where we're holding these events.
Wow.
And then finally, on our next slide, we the events that our ambassadors are holding. We're going where people are to reach folks that are experiencing serious illness. What you see on the right is a poster that we've developed. We can co-brand it in concert with the organizations where we're holding these events. Events can be at affordable housing buildings, senior daycare centers, libraries. We're holding events in the community rooms of aging and disability offices, places where people are. And what we found is that these events are best held when they're also in conjunction with other activities that are bringing people together, you know, where they live, bringing them downstairs. For example, next week, Usimi is giving a presentation at in Westwood to an affordable senior housing building with over 200 people who reside there. Majority of them qualify for Medicaid, and so the messaging is going to be very relevant. They're doing that in conjunction with a free lunch that the building provides, and then followed with arts and crafts. We also have events that are in conjunction with bingo that regularly bring a big group of people together. And that's one of the things that we at Goals of Care do, is help ensure the events will be successful alongside our ambassadors. And one of the things I wanted to touch on was that we're aiming to be as responsive as possible to the richness of our state's diversity. You know, so many people who are aging and have many years of life experience are folks who are first generation newcomers, whether they're in Atlantic City and, you know, helped build casinos so many years ago, or people whose careers began quite a while ago and now they're aging in place at home. And so we have ambassadors who several are bilingual, bicultural, speaking Spanish, and we're expanding with other languages, including Korean, Polish, and others. So we're actively recruiting ambassadors representing this cultural diversity throughout the state. And this is where y'all come in. You know, we really want support, want ideas, and want for you as connectors in your community, both to support us with finding where are the ideal locations in your community to bring these events to people who need to learn about the benefit. And also, if you know people that resonate with you, who you think would be great leaders as ambassadors, send them our way as well. because our success really depends on leaders like you, who are connected and really know best where we should be and who should be there. So this is our information. You can reach out to both of us. We're really excited to be making these connections with you and to help this program be a success, which is ultimately all about people accessing the benefit and receiving palliative care where they need it the most.
Thank you, Sandra. I'll leave this up here for a minute in case anybody wants to reach out. We will also pop it into the chat so you can all reach us. And we have a few extra minutes, so I don't know if there's any other questions or any thoughts on where we might be able to host some of these events. We'd love to hear from you about whether you think an event like this would go over well in your communities and with the people that you serve, and what you think would be the best next steps.
Lori, I just have another question. I understand that we want to educate the community, but there's still like a lot of, I feel like, education amongst healthcare workers in different capacities, whether it's home healthcare or nurses in different capacities, doctors on the importance of palliative as well as hospice care. Is there any goals on changing the attitudes and the understanding of those two components of healthcare? Like, how do we get people on board where they're also saying, you know what, check this out?
Yep. Yep. Another great question. So as part of our equity and serious illness program, in addition to the ambassadors program, we are also implementing what we're calling our champions program. That program is really a peer-to-peer, clinician-to-clinician program intended to address the barriers that clinicians have to referring patients to palliative care. So we are going to have oncologists speak to other oncologists. We are going to have geriatricians speak to other geriatricians. We're going to have primary care docs who already believe in palliative care and refer patients to palliative care help to educate their primary care colleagues in order to address the misconceptions about palliative care that exist in the provider community as well, and to lay out specifically for them what the benefits are to them and their patients for referring to palliative care earlier. We call it our Refer, Don't Defer program. And our champions are we're in the midst of recruiting those champions now, but their job will be to go and do amongst their peers and colleagues the same job that the ambassadors are doing in the community. It's to make sure that the providers, clinicians across the board, so it's not just that we're talking to doctors, we also want to be talking to nurses, to social workers, as you said, to other care providers, to ensure that they understand what palliative care is and who from their patient populations might benefit, and to make sure that they also have the tools and resources that they need to introduce palliative care to their patients, because we know that they too are trusted partners in the relationship. And if you hear it from your community ambassador, but you also hear it from your doctor and from your nurse and from and from the aide that visits you on one day a week, I think those are all reinforcing the same message. And it's very important that we deliver this message in all of those channels across multiple time periods, because you hear it once, you've heard it once, as you yourself said, Adrian, you've now heard the presentation a couple times. We keep hearing something new. So very important that we do that work. You see me, I saw your hand next.
Question. I clicked on the link that was provided in the chat to look for palliative care programs in the state of New Jersey. Are these programs are the organizations that come up, they are Medicaid approved, like that we can use them for this Medicaid, or they are available programs in the state of New Jersey?
Correct. They are right now, the programs that you can access from our directory are all of the palliative care programs in the state of New Jersey that meet certain qualifications. So they have a palliative care provider at the helm of their program, a specialist. They have an interdisciplinary team. They have a 24/7 access line. So those providers in the directory are all of the providers in the state. The state is in the process of reviewing all of the applications from providers to participate in the Medicaid benefit. And that process is taking a little bit of time. So we expect that the providers who've stood up and said that then who've submitted an application to participate in the Medicaid benefit will be available in August, and we will then you will be able to filter specifically for the participating providers, those who are participating in the Medicaid benefit on that directory. We're just not there yet, but we expect to be there in just a couple of weeks.
Thank you.
Yeah, Randy, you're on mute. And I don't know you, Randy, can you tell me where you're from?
I'm a social worker with Home Watch Caregivers in South Orange.
Great, nice to meet you. Thanks for being here.
I have one question, and that's to you, Lori, specifically, and that is, would you and your dad benefited from this program?
I wouldn't have had access to this program as my father was not a Medicaid recipient. But I would have absolutely. My father received Medicare. He was on Medicare. And had I known that there was such a thing as palliative care, I think that, we would have gone on to the directory and found one of those providers who delivers palliative care to cancer patients, and we would have accessed that care. I might not have gotten all of the services that are provided as part of the Medicaid benefit covered by Medicare, but we would have had access to a palliative care specialist. That would have been a very important addition to my father's care team that could have made all of the difference in the world for him in that last year of his life.
Okay. I totally agree with you. I had a similar experience with my mom. Luckily, I through my work at Home Watch Caregivers went to a full day, an 8-hour seminar at Daughters of Israel, and it was specifically for professionals on palliative care and hospice. And it was a fantastic day, and all of my professional colleagues felt the same way. And one of the things that the doctor who was presenting said was, unfortunately, in the medical schools, they are not teaching this. And I happen to have a nephew who was in medical school in New Jersey. And I called him after this and I said, tell me something. How much time have you learned about hospice care? He's a hospitalist now. But at the time I said, how much time did you learn about hospice and palliative care? And he said, 4 hours.
Yeah.
My
That's the problem.
8-hour session that one day was more than the medical doctors were doing.
Wow.
And when my mom was in the hospital here in New Jersey, I said, I want to talk to somebody about palliative care. I already knew and had relationships with people who were in hospice, and it was a very difficult process. We wouldn't have been eligible for this program, but I think it's important for not just people who are in Medicaid or Medicare to be educated. So I would say that these ambassadors that you have who are going out should go to every senior center, whether the people are, on Medicaid or not, because we all need to be educated about this. There aren't enough people who are.
Yes, couldn't agree with you more. And they are. Our ambassadors are not, if we were only going to be talking to the Medicaid population, it would be easiest for us to be working closely with the managed care organizations. They know exactly who those patients are. But we are going out into communities because we agree with you. This This is something that everyone needs to know about. And by the way, Medicare just released a proposal for 2027 in which they're beginning to ask for comments from the specialty community about how we might be able to include palliative care as a reimbursable service delivered through Medicare and through the home care benefits. So stay tuned. Much more to come on that. I agree with you entirely.
Any other questions? We will send the recording to everybody. Lori, will we be able to send them the slides as well? Or
Of course, sure.
okay. Terrific.
Thanks everybody for being with us. Appreciate it.
All right. Thank you for joining us. And we hope that you'll be able to follow up with Lori and Sandra and bring a presentation to your community.
We will be reaching out to you guys, so hopefully we'll be able to get an event scheduled in the early fall. Thanks so much.